know that we discontinued the regular COVID briefings, but really we're at a new stage of the pandemic, and I thought it would be important to hold this press briefing this morning. Throughout the pandemic, for 17 months, we tried to give you, people of Ohio, the most up-to-date information that we could about the COVID-19. What we're doing this morning is in that spirit as we try to bring everyone in Ohio up to date on what exactly the medical doctors are seeing statewide. We are really at a new stage in this pandemic. I think good information is always important. And good information is even more important today, I think, than ever before. As each Ohioan makes decisions about their own health, the health of their family, and the health of others who they come in contact with. So these are the essential facts. And we will hear in just a moment from Dr. Vanderhoff, who will explain this certainly in much more detail. The essential fact is that we have 3 vaccines that are highly effective. They're so powerful that we now live in a state with 2 groups of people, those who are vaccinated and those who are not vaccinated. 2 groups of people, those vaccinated who are safe, and sadly those who are not vaccinated who are not safe. By the numbers, today 60% of all adults 18 years of age and older are now vaccinated. 40% of those adults, of course, are not. If you look at those 12 years of age and up, 58% are vaccinated and 42% are not. No fact better illustrates how powerful the vaccines are than by looking at the people who have been in our hospitals for COVID since January 1st of this year, when the vaccine first really started to have a big impact. Let's look now at this data. This is the total number of people who have been in the hospital for COVID since January 1st, 18,662 people. Of that group of people, those who were not vaccinated constitute 18,367. Those who were in the hospital for COVID who were vaccinated were 295. Just a stark difference. If you break that down by percentage, that means the people who've been hospitalized since January in Ohio for COVID, 98.4% had not been vaccinated. 1.6% had been vaccinated. Again, there's no more strong testament to the power of the vaccine. We receive this information. It's updated every week, and we will be posting this every Thursday. So everyone every week can go up online and kind of see where those numbers are. We truly have 2 Ohio's. One group of people who are safe, one who are not. Making it more dangerous for those who are not vaccinated is the emergence of the Delta variant. And I'm going to ask Dr. Vanderhoff in a few moments to talk more about that from a medical point of view, but kind of the big picture. It is now clearly the dominant virus in Ohio. Going back just to May, less than 1% of lab sequence cases were the Delta variant, less than 1%. Our most recent data is from July 4th through July 17th. That showed that 86.47% of our lab sequence cases were the Delta variant. So over 86%. And Dr. Vanderhoff tells me, experts tell me that we're way above that number today. So what we're dealing with today is the Delta variant in Ohio. For those who get infected with the Delta variant, experts tell us that they very well may have a higher viral load. And again, I'm going to ask Dr. Vanderhoff to explain the real difference between the Delta variant that we're dealing with in Ohio now and what we were dealing with before. But it's really, in essence, two different things, both not good. One is it's a lot more contagious. And two is, in many cases, the individuals who get it carry a higher viral load. Thus, people are getting sicker quicker. This is one of the observations that some of the doctors have made about our more younger people. They're getting, when they go to that hospital, they're getting sicker quicker, and it's believed that that viral load, increase in the viral load, is driving that. Let me turn to some other data. Let's see where we are today about our county virus case rates. If we can go, Eric, to that chart. Recall that county case rates per 100,000 measure the amount of COVID-19 transmission in a particular county. When the rate is between 50 and 100, transmission is considered substantial. When that number is higher than 100, it means that the transmission level is high. You remember, we were very happy. We were seeing these numbers go down county after county, and it was continuing to go down. Unfortunately, these numbers are now back up. And if you look at this chart, what is in blue, all of those counties are 100 or above now. They're all moving in the wrong direction. All of those that are in blue are above 100. If you look at the rest of them, what you'll see is the vast majority of those are at least above 50. So again, that is not good news. Let's look at hospitalization. We were seeing hospitalizations go down, down, down. We were very happy about that. But what this chart shows is they're now coming back up. If you look at the first number, it is July 23rd, and we had 391 people with COVID in our hospitals statewide. The last date we have is August 5th, and that number has now climbed to 857. So again, not what we want to see. So I'm going to now ask Dr. Vanderhoff to come up, and I'm going to ask him first really to tell us about the Delta variant. Doctor, tell us, what makes this different than what we have seen in the past. And I think an understanding of that and understanding how widespread that is today is something that will be useful as people make individual decisions. Doctor, thank you.
Well, thank you very much, Governor. It's important for us all to recognize that this virus is not the common cold. This is a nasty virus that can actually cause inflammation of your blood vessels and other organs. Now, across the world and here in the United States, we are seeing a number of examples of exponential growth of COVID-19. In Florida, for example, they have seen a record single-day case of 21,000 new cases, and they're actually looking at some of their hospitals having to face the choice to postpone elective surgeries. We don't want that here in Ohio. But as you mentioned earlier, Governor, we're seeing this upward trend in COVID-19 cases and COVID-19 hospitalizations, and now Delta is dominant and it is the culprit. So there are really three key things that I think everyone needs to understand about the Delta variant. One, it is absolutely more contagious. And that simply means that it takes less of the virus to go from an infected person's nose and mouth to another person's nose and mouth. Now, estimates are that it's about 50% more contagious than the variant that preceded it. You'll recall we were talking about that as the Alpha variant or the UK variant. And it's that was 50% more contagious than the one that came before it. So what that means is that while the early variant of Delta might cause an infected person to infect another 2 people, the Delta variant might cause an infected person to go on to infect 5 to 8 other people. Another way of thinking about it is that the Delta variant is now more contagious than the common cold or the flu. Point number 2, Delta is more dangerous than prior versions of the virus. We now have data from Canada and from Scotland that show that people infected with the Delta variant have a much higher likelihood of needing to be hospitalized. And some data coming from Singapore that suggests that people infected with the Delta variant are more likely to end up in the ICU or even dying. Now, the third point, and the governor referenced this, is that there is mounting evidence that the viral loads associated with the Delta variant are higher than what we saw with previous strains of the virus. And what that means is that Delta is reproducing itself, creating more copies of itself much more quickly once it gets inside of our bodies. And this likely explains why doctors are observing more and more that, as the governor noted, Delta makes patients sicker quicker. Nevertheless, despite the fact that Delta indeed is more contagious, it's more dangerous, and it makes people sicker quicker, our vaccines remain very effective against this virus. And so I think the governor is absolutely right that as a result of Delta, Delta has created 2 Ohio's. One Ohio that is vaccinated and very well protected, and another Ohio that is unvaccinated and vulnerable to the ravages of the Delta variant. Governor?
I'd like to thank you very much. Wonder, Doctor, if you could talk for a moment about decisions that people have to make in regard to the vaccine. We still have a significant number of Ohioans who have not become vaccinated. And if you can bring us up to date about the most recent information, frankly, about the effectiveness of the vaccines, side effects of the vaccines. I know we get questions about that. We get questions about other impacts that the vaccine might cause. So if you just take a moment to answer that for us.
Well, thank you, Governor. And you know, really what Delta variant is causing all of us to do is have to look at the risks it's creating and balance risks. Now, you know, we do this all the time. If I'm going out on a sunny day, I'll put on sunscreen, and I might even layer on additional protection in the form of a hat and sunglasses. In a similar way, if one were hiking in the woods, you might put on bug spray. With the Delta variant, if you're in a crowded indoor setting, potentially with many unvaccinated people, you might want to put on a mask. In addition, if you're an unvaccinated person and eligible for the vaccines, the best thing you can do is get vaccinated. Delta spreads like wildfire, and it seeks out anyone who's not vaccinated. But there's good news, and there are really 2 things that remain very, very clear. Number 1, our vaccines are absolutely the key to containing this fire and ultimately to putting it out. And secondly, vaccination is without any doubt your best bet, regardless of your age, for avoiding getting really sick from COVID-19 and for avoiding some of the lasting complications like long COVID. So, for anyone who is on the fence, trying to decide whether to go ahead and get the COVID-19 vaccine, please remember, this is not the common cold. This is a bad virus that can cause otherwise healthy children to develop a multi-system inflammatory condition that makes them very sick and puts them in the hospital for a very long time. It is a virus that has landed tens of thousands of Ohioans in the hospital and killed tens of thousands. And yet nearly all of that can be avoided by vaccination. Governor?
Doctor, thank you. Doctor, thank you very, very much. We do have other good news. We're seeing more Ohioans who are now becoming vaccinated. For example, in the last several weeks, as Ohioans have seen the spread of the Delta variant in their communities, more Ohioans are now getting vaccinated. We've seen increases of vaccinations in 85 or 88 counties in July compared to the previous month. The news is even better more recently. Last week, we saw increased vaccinations in all 88 of our counties, if you compare that to the first week of July. Additionally, we've seen our largest increases in vaccinations in our lowest vaccinated counties. Among the 22 counties that have the lowest vaccination rates, we have gone from 1,183 to 2,735 vaccinations in the last week of July compared to the first week of July. In other words, make it simple, counties that had the lowest vaccination rates are now seeing the greatest increase. This chart shows the increase in vaccinations around the state since July 4th. So that's overall statewide. Let me now go to the next chart, Eric, just to take three counties. Here you can see three counties that were lagging in vaccinations and the increases they have seen during the past 4 weeks of July. Adams County, which was 87th in vaccinations, represents the top line. They went from 42 vaccinations for the first week of July and the first week of July to 158 in the last week of July. Ashland County, which has also been low in vaccinations, is your middle line that you're looking at. They rose from 95 vaccinations in the first week of July to 199 in the last week. Finally, Holmes County, which has given the fewest vaccinations in the state, is the bottom line. They jumped from 24 vaccinations to 92. These three counties have had the three largest increase in vaccinations by percentage, so we're happy to see that. Vaccines are making the difference, and that, frankly, is where we will continue to put our focus, and that's why we're doing this press conference today. The most amazing, the most remarkable, the most effective tool that we have today is the vaccine. It is even more effective, more powerful than was ever imagined by medical professionals before it was developed. As former Trump administration Department of Health and Human Services Director Alex Azar wrote this week in the New York Times, and I quote, "The vaccines, quote, work incredibly well, and more than 160 million fully vaccinated Americans are proof of that." He also said that all the vaccines given to Americans over the past year have provided, and I quote, "provide us with some of the most robust real-world evidence of their safety and effectiveness that we've ever had for new vaccines," end of quote. I want to talk about some other good news things in regard to the vaccination, and that is a great effort that's being made by so many different organizations and people across the state. We've seen examples of communities that are working together to make sure vaccines remain readily available and accessible. Local health departments, our universities, our schools, our employers, our pharmacies, nursing homes, hospitals, community health centers, primary care physicians, pediatricians are working very hard, community after community, to make the vaccines available to every Ohioan. For example, nearly 200 of our school districts have reported having on-site vaccination clinics for students this summer. Local health departments, an example would be Tuscarawas County Health Department, have partnered with community and volunteer groups to ensure non-English speakers interested in getting vaccinated will have access to translators. We appreciate that creativity. We know that every community in Ohio is just different. One size does not fit all. We leave it up to the local communities to make their decisions about how best to make this vaccine available. But to encourage vaccination in communities, we do let local health departments know, and we have let them know that they could use previously provided coronavirus relief and immunization funding to provide incentives to their residents. Again, this is up to the local county, but we want to make sure they understand that they can do that, and we have told them that. Some counties have teamed up with area partners to offer gift cards or discounts at local YMCAs, YWCAs, movie theaters, breweries, and more. Each county doing it a little differently. Some local health departments are focusing on educating Ohioans about the safety and the effectiveness of the vaccines. Examples, Trumbull County and Warren City Health Departments teamed up after they noted increasing case counts. Officials held a press conference. They talked about the importance of vaccinations and explaining how residents could easily get their vaccines at a standing clinic at an area mall where recipients would receive a small gift certificate after vaccination. And it worked. The site had been administering about 15 vaccines a day. The day after the press conference, the site administered 90 vaccinations, a record for that location. Throughout Ohio's vaccination efforts, we have seen that financial incentives can, in some cases, serve as a motivating factor for some people to get vaccinated. A study just published in the American Journal of Medicine makes an estimate that 115,000 additional Ohioans receive vaccinations as a result of our Vax-A-Million program. We're happy to help with these incentives at the state level if a county thinks that monetary incentives are the best fit for that county. We're happy to help with anything that the county thinks will work. Last night I had the opportunity to talk to our health commissioners, and we talked about our willingness to work directly with them. Whatever they think will work in their county, we want to be there to help. Every county is different. Incentives work in some counties, and incentives may not work in other counties. Let me give an example of a place where it certainly worked. On July 6th, the Columbus Department of Health, in response to declining vaccination rates, opened 10 neighborhood satellite vaccination clinics in traditionally underserved areas where individuals would receive a $100 Visa gift card for getting their first shot. Columbus Public Health laid the groundwork, getting feedback, identifying locations, canvassing neighborhoods, securing health educators to answer residents' questions. So it was a holistic approach, not just the incentive dollars, but a holistic approach. Columbus Health reported 253 vaccinations in the week of June 27th. The following week, when their incentive program began, vaccinations increased to 983. During the second week of the program, vaccinations increased to 1,491. Vaccinations continued to climb into the third week when Columbus Public Health reported they vaccinated 1,826 people. Most recently, last week, they reported vaccinating 1,814. So we want to continue to support these creative local efforts. Last night, as I said, I spoke to our health commissioners from around the state and told them that we want to support their efforts, whatever they want to do, whether it is for more incentives, such as the $100 cash card or other approaches that will work best locally. Again, where the state can help, we will. Our goal is to make it as easy as possible for Ohioans to access the vaccine. We've also talked about what we have done in regard to our Medicaid members, and that work is a work in progress. But in fact, we have already seen a 55% increase in Medicaid members 18 and older who have completed vaccinations since we issued a challenge to our managed care plans. And so that is moving forward. Additionally, we recently announced an incentive for state employees to get COVID vaccine. This is very similar to what we do in regard to the flu. It's done through our managed care with the whole idea of not only keeping people safer and healthier, but saving money as well. Let me just conclude before we go to questions. We wanted to hold this press conference today to bring everyone up to date in Ohio on exactly where we are. The name of the game today is vaccines. This is where we win. This is where we don't win. We have two Ohios. We have people who are vaccinated who are very, very safe today. We have people who are not vaccinated who are not safe. And they are more imperiled because of this Delta variant, which is more contagious and many times carries a more higher viral load when that person receives it. So it is a critical period of time. One group of people go about their business with very good confidence that they're not going to end up in the hospital. Another group of people, we cannot say that. And so individual choice is what we are about at this point in the pandemic because we have the vaccine. Schools are making choices now. We believe in local education, local schools making decisions. Businesses, hospitals, all are making decisions based upon the facts. I wanted to speak to you to make sure everyone has the facts that we have. And when facts change, we will be back to give you additional information. And in the meantime, everyone can always go to our webpage, and we'll continue to put more data up on that webpage to let people know exactly where we are. I'll be happy to answer any questions, and Dr. Vanderhoff is still here, and he is certainly ready to answer questions as well.
First question today is from John London at WLWT in Cincinnati.
Hey, John.
Hi, Governor. I'm interested in hearing from you and from Dr. Vanderhoff on this because what you just said leads me into the question I was going to ask. The CEO of UC Health said yesterday emergency authorizations wasn't even a factor in deciding that Cincinnati hospitals will now require their staffers and employees to get vaccinated by October. That the science is clear and the vaccine has been tested so much they felt there's no reason to wait. Are some hospitals jumping the gun here? Or are they right that evidence of efficacy is already in and all hospitals and health systems should just go ahead and require the vaccine?
Well, I'll let Dr. Vanderhoff do the medical side of that. I would simply say that when we go to a hospital, or more importantly, when we take a child to a hospital or a spouse or a loved one, we rely on that hospital to do absolutely everything in their power to make that a safe visit. No one wants to go to the hospital, but we want to be assured that the hospital is doing everything in their power to make sure that we are safe when we are at the hospital. We don't get COVID. We don't come down with something else. And I think we should trust our hospitals. Doctor?
Thank you, Governor. I could not agree more. And I think that what we're seeing our hospitals do really is one more vote of confidence in the power of these vaccines. This is one more indication from healthcare professionals that our vaccinations remain very effective in the face of the Delta variant and frankly are the best way to keep not only these healthcare providers safe, but to keep the patients that they are charged with responsibility for also safe. Thank you.
Next question is from Kevin Landers at WBNS in Columbus.
Good morning, Governor.
Kevin.
Knowing what you just laid out, if not for SB 22, would you today be mandating masks statewide? And for Dr. Vanderhoff, there is talk that's on social media that natural immunity lasts longer than the vaccine. Can you please tell us what the science says about that? Thank you.
Kevin, you've heard me say this before. I take the world as I find it, and we are at the point today in regard to this pandemic, well over a year into it, where individual choices is the most important thing. It's where we are. we have the vaccine. And so people can choose to get that vaccine. We also have, they know the power of mask. They can make those decisions. Institutions can make those decisions. So I think, that really is where we are today. And my job, the reason I'm here today doing this, and I've asked Dr. Vanderhoff to be here, is to convey directly to the people of the state of Ohio what we're seeing, what the Delta variant, what the danger is from the Delta variant, what the data shows, how safe people are when they get the vaccine, and frankly, how they're not safe when they don't get the vaccine. Doctor?
Thank you, Governor. In terms of that very important question about vaccines versus natural infection, here's really what people should be thinking about. Both the vaccines and natural infection do have the ability to create lasting, durable immunity. And we are watching how long that is in both cases every day. But there's a real important difference between vaccination and getting wild COVID virus. Vaccination gives you a much more predictable response. We know that people with infection have variable responses. Some people have very robust immunity they develop. Others have much less robust immunity, and a good way of proving that is the fact that we have people who, after a few months, end up getting reinfected with COVID when they've had a previous infection with COVID. The other important point is, of course, the vaccine is very safe. The vaccine is not going to land you in the hospital. The vaccine is not going to produce long COVID or the multi-system inflammatory issues and the many other problems that we outlined today. So safe and very predictable response, it's the better way to go.
Thanks, Doctor.
Next question is from Scott Hallis at the Xenia Daily Gazette.
Hey, Governor, how are you today?
Yes, Scott.
So there's been talk about, the boosters with the vaccination. Is there any evidence right now that a booster could, keep people who are currently vaccinated? And this may be a better question for Dr. Vanderhoff. That the booster could keep currently vaccinated people from getting the Delta variant altogether and, not being able to spread it? Or are we not at that point yet? Do we not know?
Scott, I'll let Dr. Vanderhoff answer that. I'll just also say congratulations on being named editor of the 3 Greene County papers. Doctor?
Thanks.
Thank you, Governor. So the issue with the vaccines and the Delta variant that's a really important question. I know it's on many people's minds. It's a question that I'm getting fairly regularly. The data is very clear. All 3 of our vaccines remain very effective against the Delta variant. In terms of, do we need boosters? As you may recall, the ACIP, the advisory committee that guides the CDC on this, has met about a couple of weeks ago, looked very closely at that. And the only thing that they found looking at the data was early indications that perhaps people who have known impairments of their immune system may need an additional boost, but they needed more review and referred that on to the FDA advisory committee, which also has excellent medical experts. So long story short, for the vast majority of us, it does not appear right now like there's any need for a booster for the Delta variant.
Thanks, Doctor.
Next question is from Dan DeRose at WOIO in Cleveland.
Good morning, Governor. How are you, sir?
Good morning.
I'd like to talk about your frustration level. You've seemingly done everything you can. There's vaccine at every corner around the state at pharmacies, but yet I'm sure you get them. Just last night, 2 of my friends who are just completely devoid of wanting to grab facts. 165 million Americans vaccinated. None of them have dropped dead, or the overwhelming vast majority have not dropped dead, contrary to what social media says. 98% of the people in our hospitals have not been vaccinated. What is your frustration level, and how do you handle people who come at you and say vaccines don't matter and I'm not getting the shot?
Well, we've tried throughout this to give people the facts as we know them, when we know them. And we did that from the first day, and we will continue to do that. I think, that is my obligation to the people of the state of Ohio, to tell them the truth, to tell them what we know, and to do it in a very, very timely basis. That's why we're doing this press conference today. We're really at a different stage of this. We now have this Delta variant that is everywhere in Ohio, as Dr. Vanderhoff a month ago predicted. We now have a Delta variant that is more dangerous. People get a higher viral load, which in some cases results in people getting sicker faster, as doctors have observed in the hospitals. The data is just abundantly clear. We have now month after month data of who's in our hospitals, and better than 98% of the people who end up in our hospital are not vaccinated, and that sort of tells us something. So my job, I think, is to, at this stage, when we're well into this, and when we have the vaccine available, is to give people the basic facts. Now, we do have some people, 11 and under, who cannot be vaccinated. And, I think we need to worry about them. I'm going to ask Dr. Vanderhoff now to talk a little bit about those, because when we talk about choice, free choice, when we talk about free will, when we talk about everyone making their own decision, we do have some Ohioans who simply cannot be vaccinated. And I think that's something that we need to keep in mind as well. And I don't think it's something we have not really talked about this morning. Doctor, you want to just add something on that?
Thank you, Governor. Well, that's absolutely true. We are still waiting for those who are less than 12 years old to be declared safe to receive the vaccine. And so while we're in that holding period, I think it really is incumbent upon those of us who can be vaccinated to be thinking about what we do in our families, in public places, and in our schools to protect those who do not have the option to get vaccinated. And really, the best opportunity, the best option are those same layered protection measures that we talked about last year and which worked so well in our schools throughout the last school year. And you'll recall, those were having everyone mask, maintaining distance between people, maintaining good hand hygiene, and thinking very carefully about ventilation. So those are all very, very important. Those remain important. And I think the governor is right to remind us that we do have young ones among us who it's our collective responsibility to protect. Thank you.
Next question is from Farnoosh Amiri at the Associated Press.
Hi, Governor. It's bittersweet to be back doing this, but thank you for taking the time today. I wanted to talk a little bit about, we discussed SB 22 and we talked about Columbus being an area where you're saying, incentives are working and are getting people excited about getting the vaccination and are changing, rapidly changing the vaccination rates, but they're not doing it quick enough or as well as, health experts and even yourself would want. This week, Dr. Mashika Roberts of the Columbus Department of Health talked about how she would have come out and gave in a mask mandate for the city of Columbus, but she can't do that because of SB 22. So I want to hear about your thoughts about how this could be a hurdle for local officials, public health officials, as they go into, as you say, this new stage of the pandemic.
Well, we have a lot of people who are making decisions. Local school districts are making decisions of how to handle what they have in front of them. I think that as we make decisions in life, we calculate risk. And I think it's just important that as people calculate risk and they make a decision, am I going to get vaccinated? Am I going to have my child get vaccinated? Am I going to do this? Am I going to do that? that we give them as much information as possible as they make that risk calculation. And so that's really, what we're about today. One of the calculations that schools are making and parents are making, I think, has to do with, what they do in school. Do they wear a mask in school? First, does the school decide everyone will wear a mask? If the school doesn't decide that, then will the parent say, I want my child to wear a mask? And I want to ask Dr. Vanderhoff for a moment to talk about, we put out guidance yesterday, the health department did, in regard to quarantining in school. And in essence, there really wasn't a change. What we said was, what we found out last year, that when kids are in school and are masked, even when they're in a fairly crowded classroom, they do not spread that. If you remember when we found that out last year, we were being called, I was getting emails from superintendents say, hey, kids are not, we're quarantining them for this long a period of time, but they're not getting sick. We don't think they're getting it. And then we went in, we tested, and we found out, lo and behold, the superintendents and the principals were absolutely correct, and the teachers were correct. These kids were not getting it. So we changed that then. The guidance we put out yesterday really reinforces that quarantining rule. And I want Dr. Vanderhoff to talk about that for a moment, because as a parent or as a school, one of the things I think we all want is for our kids or grandkids to stay in school. And that is a number one high goal. We want kids to be in school this year. We don't want them to be out, and we don't want them to be sitting out quarantined for a couple of weeks. If they play, if they run cross country, if they play football, whatever they do, we want them to be able to have that sport. If they are in debate club, we want them to be able to do that. Whatever it is, we want them to be able to do that. Doctor, you want to talk about how the guidance we put out yesterday, which really is a repeating pretty much of what we said last year, can directly impact whether kids can play sports or not.
Thank you very much, Governor. Absolutely. If you look at that guidance, you'll see that first and foremost, we affirm that which we knew from the Ohio schools COVID evaluation performed by university researchers across our state last year and our experience in our schools, which is that schools that apply a comprehensive strategy of safety, including masking for all the people in the school, create a very safe environment for students in relation to COVID. And so when there is a child who turns out to be in a classroom and is positive for COVID, it is not necessary for their classmates to go into quarantine to prevent spread. They can continue to attend class and participate in extracurriculars as usual, and that represents no change in our guidance from what we offered as guidance last year. However, we also recognized that since we offered that guidance last year, there have been new developments. We now have the availability for older students to receive these wonderful vaccines. And in circumstances where children may be in schools that are not applying the very comprehensive safety strategies that worked so well last year, including masking, but who nevertheless themselves have been vaccinated or are wearing a mask consistently when they are at school, we offer them safe pathways to continue in school and to participate in extracurricular activities that do require them to go through some extra steps until we are confident that they in fact were well protected and can resume their normal activities. Unfortunately, for students who are not vaccinated or masked and are in schools who are not applying those comprehensive strategies, they will have no choice but to quarantine. Thank you, Governor.
Thank you, Doctor.
Next question is from Jackie Borchard at Gannett, Ohio.
Jackie?
Hey, Governor, how are you?
Good.
Earlier in your briefing, you showed a chart showing breakthrough cases for hospitalizations. I know the CDC stopped monitoring breakthrough cases back in May, but more than a dozen states have continued to report them. Vaccination status is something that's reported in case information. So why is Ohio choosing not to make this data available?
I will have to check on that. I mean, you certainly can see the numbers I showed you in regard to hospitalizations. So, you know, we are making that information available in regard to hospitalizations. You know, it's plain. It's right. It's right there. You do see some people who've gotten the COVID, who had been vaccinated, who ended up in the hospital. To me, that is a very telling figure. We also can give you the figures in regard to the people who were vaccinated and ended up dying. Again, it's a very, very small number. So you're getting those two most important pieces of information. I don't know, Doctor, if you have any comment about what the rest of that would be, which would simply be people who have been vaccinated, who got COVID, who didn't end up in the hospital, or who didn't die. Doctor?
Thank you. We agree with the CDC that the best practice in terms of monitoring these vaccines is to monitor breakthrough cases for hospitalizations and for deaths. And that's for a number of reasons. One is that the primary goal, the primary endpoints for these vaccines is in fact to keep you out of the hospital and to keep you from dying. And they're doing an exceptionally good job at that. Remember, the efficacy of these vaccines from the very beginning has focused on the prevention of those severe outcomes. Also, from the beginning, we have recognized and observed that there can be people who are vaccinated who develop a mild illness or maybe even an asymptomatic infection. That actually does not represent a failure of this kind of vaccine. And without going into too much detail from the scientific point of view, I can simply say that this kind of vaccine, which is called a mucosal vaccine against a mucosal virus, that's how they work. And it is different than the way perhaps a vaccine against something more like measles works, where that question might be more relevant. So bottom line is, this is the standard way that doctors look at the impact of this kind of vaccine. And so I think it really is appropriate that that's how we're monitoring it.
Next question is from Laura Hancock at cleveland.gov.
Hello,
Laura.
Dr. Hi, Dr. Vanderhoff and also Governor DeWine. Do you think it's safe to send unvaccinated kids to school without masks?
Well, I'll let the doctor answer the question. I think that you know, my advice, and I'm not the doctor, but my advice is if a child is not vaccinated, and if it was my child, I would send the child to school with a mask. Doctor, I'll let you answer the question.
Thank you, Governor, and I agree with you. I think what we have clearly outlined is that this is not a benign virus. I think in many circumstances, well-meaning people have thought mistakenly that this is just like getting the common cold. It's not. This is something that is dangerous. And this is something that even for children, albeit infrequently, even for children, it causes some very bad outcomes. And you know, the problem with some of the bad outcomes for children with this virus is that the multi-system inflammatory condition of children, the condition I've referenced that causes multiple organs to become inflamed and lands children in the ICU, you know, it very often is striking children who were otherwise pretty healthy and whose parents certainly would not have expected their child would be the one afflicted with that condition that is the result of COVID. So as a parent, I am looking at this and weighing those risks, making those risk calculations, and thinking I would want to do everything in my power to give my child the safest possible way of going to school. And if I weren't able to vaccinate my child, I sure would want them to wear a mask.
Thanks,
Next
Doctor.
question is from Tom Gallick at Gongwer News Service.
Hi, Governor.
Tom.
Started to see some businesses around the state say you have to present some kind of proof that you've been vaccinated to come in. Do you view that as appropriate? And do you see any scenario where the state would help out or help administer any kind of vaccine passport system?
You know, I think that every business, hospitals, schools, on and on, are trying to navigate this and trying to figure out, you know, how they can keep their employees safe, how they can keep their customers safe, how they can keep their patients safe. So I think, you know, everyone is making those decisions and trying to work their way through it. I do not have any plans, you know, to come up with some sort of a passport or some sort of a indication that you have been vaccinated. I think at this stage, you know, it's really not a practical thing that could be done.
Next question is from Alexis Moberger at WSYX in Columbus.
Hi, Governor. Thanks for taking our questions. You said that you're planning on encouraging health departments to offer incentives, but there was that recent study that said the Vax-A-Million may have not encouraged as many people to get vaccinated as originally thought. Going forward, do you think that these incentives will work to get more people vaccinated?
Well, first of all, I think that's up to the local health department. I talk to health departments all the time. I talked to them last night. I talk to them at least once a week. Clearly, some of them feel that incentives simply will not work in their county. Others have demonstrated that incentives do work in their county. I think that if you look at what Columbus has done, for example, there's about 7 ingredients. And I think if you do all those things, then many counties would be successful in increasing the number of people who are vaccinated by those incentives. As far as the Vax-A-Million, look, we've gone through and looked at that particular study. We think it's a very flawed study. What you really have to look at, and what sometimes is missed, is how these numbers fill in. And what you really need to look at is you need to take the vaccination number, not from the day it's reported, but from actually the day that it occurred. And so you can't do those until you get farther enough away from it. That particular study didn't do it accurately. The study that just I cited earlier on, put the figure at 110, 115,000, an increase. We think that's a minimum. Frankly, that was about what we had figured before. We did not count in that number, though, any increase that we would have received from people 12, 13, 14, 15, and 16, and 17, because it coincided, being able to vaccinate those people coincided with the same time we put the Vax-A-Million out. So we just took those out. But we know for a fact, because of discussions, anecdotally at least, there are some people who did in fact get the vaccination earlier simply because of that Vax-A-Million. And in fact, one of the ones who did that, mother told us that, and it was a winner who had won the scholarship, and she told us that. So anyway, this is up to every county. My message to the health commissioners last night is, we appreciate what you're doing. We're here to help. You know your county. If you want to try something that will increase vaccinations, we're here to help you do it.
Governor, next question is for the last question today, and it belongs to Tom Jackson of the Sandusky Register.
Hi, Tom.
Hi, Governor. I have a follow-up to the last question. There's a new economics paper to economists in California that say that your Vax-A-Million program was effective. Do you have any plans for a new state program, incentive program, as opposed to these county programs you've been talking about?
We're not announcing anything today, Tom. You know, I've learned that as this virus changes and we get new facts and we watch this thing that, you know, you can't predict what you're going to do. We're going to keep our options open. We're going to do, you know, what we need to do, but I'll close this press conference the same way we started. The vaccines are powerful, unbelievably powerful. We can get on discussions about masks. We can talk about a number of different things, and people get very emotional and get upset. And I understand all of that. And those are discussions that are proper. But I would simply say we do not want to lose sight of one central important fact. And that is the best way to beat the Delta variant, the best way to keep your family safe is to become vaccinated. It is powerful. It works. And we shouldn't let any other discussion that is going on allow us to deviate from that focus. We must focus on vaccines like a laser. They are just amazingly powerful. Now, we're not going to compel anyone. You know, state is not going to do anything where we tell people they have to be vaccinated. This is their individual choice that they will make. But this is where the game is. This is where the game's going to be won or lost. This is where lives are going to be saved, and that's from the vaccine. So thank you all very much. Hope everybody has a good weekend. Thank you.
Recording stopped.